What a day. Good afternoon, and thank you all for joining us for a special Government of Newfoundland and Labrador's COVID-19 update for today, Wednesday, a day in history, December 16th, 2020. This is a huge day for Newfoundland and Labrador. It brings hope and optimism for a bright 2021. Just moments ago, I had the honor of witnessing Dr. Fitzgerald administer the very first COVID-19 vaccine in the province, and to personally thank the first two people to receive that vaccine, Nurse Ellen Foley-Vick and Dr. Jatin Morkar. Dr. Morkar and I worked well together in the beginning of COVID-19 pandemic, and it was very fitting that he, who led the charge for Eastern Health, be one of the first to receive the vaccine. They've both seen the front lines since the beginning of this pandemic and were instrumental in our province's response. To hear Dr. Morkar shared story about how he shared a story about how intense it was at the very beginning, and how he had to isolate away from his family, only seeing them in his very house over Zoom or Skype to keep them safe, was indeed touching and speaks to his dedication to this pandemic. I was also happy to meet the rest of the dedicated healthcare professionals who received the first batch of the COVID-19 vaccine in Newfoundland and Labrador today. They've been through a lot. As a province, we've all been through a lot. Feels strange almost to reflect on how I was right there with them at the very start of this pandemic, and now sitting here as your Premier with Dr. Fitzgerald and Minister Haggie. But this is just the beginning. As more vaccines land on the shores of Newfoundland and Labrador, more and more of us will get them. Frontline workers and people more vulnerable to COVID-19 will be in that group, including our Indigenous peoples. I hope we can all breathe a collective sigh of relief today, and thank Dr. Fitzgerald and Minister Haggie, along with everyone working tirelessly throughout this pandemic. Helping us navigate this pandemic so well is because of them. I hope you all thank yourselves, most importantly. Newfoundland and Labrador, you're doing great, but this is not the time to let our guard down. Please continue to follow public health guidelines, especially as holiday celebrations ramp up. This holiday season is not like others. You must continue to follow public health advice. Wear a mask, wash your hands, keep your distance, and please be kind. Take care of yourselves and each other. Thank you. I'll now turn it over to Dr. Fitzgerald for her daily update.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. Since the media advisory yesterday, we have 5 new cases of COVID-19 in our province. First is a male in the Eastern Health region between the ages of 50 and 59, and this is a travel-related case. There's also a male and female in the Eastern Health region between the ages of 20 and 39, and these are travel-related cases as well. The fourth is a male in the Central region between 20 and 39, and that is a travel-related case. And the fifth is a male in the Eastern Health region under 19 years of age, and this is a travel-related case. There have been 2 recoveries since yesterday, leaving 23 active cases in the province. As a reminder, people who have recovered from COVID are considered free of the virus and are able to return to regular activities. There should be no fear of interacting with these individuals, as they cannot spread the virus. So please be kind. The total number of cases in our province is 364, and in total we have tested 68,325 people. I would like to begin today with details on our plan for the distribution of the COVID-19 vaccine. As anticipated, the first shipment of the vaccine arrived in our province yesterday, and we have identified the priority groups to receive the vaccine according to a 3-phase plan. We are aligning our vaccination plan with the recommendations of the National Advisory Committee on Immunization. This is an external advisory body of experts that provide advice to the Public Health Agency of Canada on immunization. As I indicated last week, there are restrictions around the distribution of the first allotment of the Pfizer vaccine, which was approved by Health Canada. It is a frozen vaccine and must be transported and stored at temperatures of -70 degrees Celsius. This vaccine will thaw 30 minutes at room temperature and 3 hours in a fridge, after which it has a limited shelf life, so it is essential to maintain these low temperatures. At this point, the vaccine is not transportable, and the manufacturer requires us to administer the initial immunizations at the central distribution site. This site must have an ultra-low temperature freezer, and therefore the first shipment of vaccine was sent to Eastern Health. Given the need for mobility, we have determined that healthcare workers in the highest risk settings and essential to the COVID-19 response will be the first recipients of this shipment of vaccine. It is important to prioritize healthcare workers in order to maintain workforce stability, preserve healthcare capacity, and limit the spread of COVID-19 infection in healthcare facilities. To that end, we will be immunizing staff in the following settings: COVID-19 testing and assessment clinics, emergency departments, labor and delivery, those involved in COVID-19 immunization programs, and those who work in COVID-19 units and critical care units. These are the healthcare professionals most likely to come into contact with COVID-19 and transmit to high-risk individuals, or are essential to maintaining the provincial COVID-19 response. Other healthcare workers will be prioritized as more vaccine supply becomes available. Regional health authorities will coordinate the movement of priority healthcare staff to the central distribution site. And additional ultra-low freezers will soon be arriving and placed in each of the other 3 health authorities, and administration sites are planned for Gander, Corner Brook, Labrador City, Walwish, and Happy Valley Goose Bay. Once we have a vaccine that can be more easily transported, we can begin to vaccinate other key priority groups for phase 1. And these would be those in congregate living settings for seniors, such as long-term care homes and personal care homes, and that would include staff and residents. Those adults with advanced age, and those living in remote and isolated Indigenous communities. Our goal for the first quarter of 2021 is to vaccinate those who are most vulnerable to the severe effects of COVID-19, those who are at risk for contracting the virus through work in the health system, and those who can transmit the virus to those at risk for severe disease. Phase 2 will commence once new information on the mobility of the Pfizer product is available, or once the Moderna vaccine becomes available. We will then be able to vaccinate those in priority groups who are not able to travel to receive the vaccine. And phase 2 may actually be a very short phase. Phase 3, the transition to phase 3 will be based on further vaccine availability and will involve the administration of vaccine to other priority groups and the general population. It is anticipated that we will have enough supply to vaccinate everyone who wishes to be vaccinated by the fall of 2021. As you can tell from this information, patience will be critical. We all need to have reasonable expectations around timelines for the vaccination process. The COVID pandemic has been constantly and rapidly evolving. That could very well be the case as we roll out the COVID vaccine. We will be ready to adapt our plans if and when the circumstances change. As a recap, for those who may have just joined, we have 5 new cases since yesterday's media advisory. The total number of cases in the province is 364. This is the beginning of the end for us. We are halfway there and should be very hopeful. There is still much work to be done, and COVID still moves among us, so we need to continue with our public health measures for the foreseeable future. We have come so far and done so well, and the end is in sight. So we need to hang in there for a little bit longer. So take care, be kind, and hold fast. Thank you.
Thank you, Dr. Fitzgerald. Minister Haggie, do you have some remarks?
Yeah, thank you very much, Premier. I don't have many. I think today has been a landmark, exciting day. It was a real boost to see the look on people's faces in the vaccination area in Eastern Health when we went there earlier on. It's day 284 and it's finally vaccine day. I think I would echo Dr. Fitzgerald's comments, though, that this will be a process as we get our apportionment of the vaccine. That will come in stages over the course of the first and second quarter of next year. And until a significant proportion of the population actually have the vaccine and have developed immunity, we are going to have to do what we've done so well at thus far, which is to rely on public health measures. Social distancing, wearing of masks, hand sanitizers, and good cough and sneeze etiquette. Following Dr. Fitzgerald's guidelines and the special measures orders has served us well and will have to serve us well until such time as we can get that proportion that we need to of the population vaccinated. For comparison, this year, so far we have either booked or delivered flu vaccine to 52% of the population, a significant increase over previous years, but not as good yet as we would like that to be, and certainly not as good even as we managed during the H1N1 period. These are a test run, the flu vaccines, for how we will distribute the COVID vaccine, particularly when we get more flexibility around moving the vaccine from its delivery point. Those mechanisms are there, they're tried, true, and have worked. And again, I would echo what Dr. Fitzgerald says. The beginning of the end is here. We're not there yet, and the marathon, unfortunately, will continue for a bit longer. So hold the line and hold fast. Thank you very much, Premier.
Thank you, Minister. We'll certainly now open it up to questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 6 reporters registered for today's call. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
All 3 of you are on the front lines of this pandemic. When do you expect that you'll be receiving a vaccine?
Well, we're actually not on the front lines right now in the true sense of the word. I was, but not right now, and so they will receive the vaccines when our demographics and groups are prioritized accordingly.
In other provinces, they're expanding where the Pfizer vaccine is distributed next week. There's going to be, I believe, 70 sites across the province, or across the country, rather. In Newfoundland and Labrador, because we only have the freezers in St. John's, we're only able to receive them here. We've known for months that this vaccine was going to be one of the most promising candidates. Why didn't we invest in freezers in more sites to be able to roll this out more quickly in other places?
We have invested in those freezers, Peter. The challenge is the market has been unable to respond to the demand in a timely way. We have acquired 1 Public Health Agency of Canada provided freezer, and that has gone to Eastern Health's Vaccine Depot. We are currently working with borrowed freezers from the university. The next freezer we anticipate will be the end of December or early January. Once that is tested and validated, that will go to Goose Bay. And then we are expecting 5 more ultra-low freezers in addition to those, hopefully over the course of January. So again, it's a lag because of demand. These are not items you can go to Costco and buy.
Peter, I think it's also worth kind of remembering that this is ahead of schedule. So I think that's key in recognizing that we are ahead of schedule, we're ahead of where we wanted to be, and today is a good day for Newfoundland and Labrador.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi. The Peters are first today. Can you explain who qualifies as an immunosuppressed person, since that can refer to a broad range? So who are the immunosuppressed people who are not recommended to get this vaccine?
It's certainly very much a broad range. Dr. Fitzgerald, do you want to?
Yeah, so I think, I'm not really qualified to determine if someone is immune suppressed or not. That would have to be a discussion that happens with a person and their care provider, healthcare provider. But certainly we know that there are some medications and certain conditions that can cause immune suppression in people. Those people were unfortunately not included in these trials that happened, and so because of that, we don't have evidence to support or not support using the vaccine in this group. So it has to be a discussion with the healthcare provider and weighing of risks and benefits, and so it can be quite individualized and case by case.
Okay, thank you. And again, in terms of people who do not qualify, I understand that includes pregnant women, children, and immunosuppressed people. Have you garnered an estimate of how many people in the province do qualify for the vaccine?
No, I don't have that number to hand, but it's certainly something that we'll be determining as time goes on.
Our discussions with health ministers meeting, we have aimed for vaccine supply for 75% of the population as a minimum, just as a global number, with an addition of 5% for potential wastage. So we would anticipate by the time that the vaccine has been completely distributed for the first run round the province, we would have sufficient to vaccinate that proportion of our 519 odd thousand people.
Thank you.
Our next questions are from Jody Cook with NTV. Please go ahead.
Thank you. Premier, in your preamble, you talked a little bit about during the vaccination rollout. We understand this is going to be a timely process, and right now we're dealing with Pfizer, and we've got some of the restrictions and limitations that exist with the way that this vaccine is stored and the negative temperatures required. Previously, we've talked about the Moderna vaccine, and you talked in the preamble about it, some of the Indigenous peoples and maybe our rural communities. Moderna was considered as the possibility for servicing some of those communities. Can you elaborate a little bit on where we might be for that with Pfizer versus Moderna?
Sure. So, as you correctly pointed out, the Pfizer vaccine is more unstable than the Moderna vaccine, and consequently needs to be stored in these ultra low temperatures and requires special equipment. The Moderna one is more stable and is able to be transported albeit frozen, but less low temperatures, slightly higher temperatures. So it's more easily transported to rural and remote communities. As you are aware, the Prime Minister announced yesterday that there are secured for Canadians doses of the Moderna vaccine pending public health approval or Canada Health approval. And certainly we're looking forward to seeing what Health Canada says, and hopefully it's approved and the shipment comes swiftly. And it's certainly something that the vaccine team is considering with respect to our rural and remote communities, including our Indigenous communities on the coast of Labrador.
In the early stages of this, we were introduced to the alert level system, and I think it was the 30th of April when this system was put in place. At that time, there was the discussion that when the vaccine becomes available, we would move to alert level 1. It appears now like that this is not going to be an immediate change, that we would be moving into level 1. At this stage where we see today an historic day, would we move into alert level 1 at any point soon? Would it need to wait until we have a significant rollout on the vaccination process, or would we skip it altogether and not go into alert level 1 at all?
Well, certainly this is a time of transition, but Dr. Fitzgerald, do you have any particular comment on the levels?
Yeah, so alert level 1 is not just solely determined by whether or not we have a vaccine. It has to do with a few other things. So, if COVID spread throughout the world, had somehow come under control even without a vaccine, or in the rest of the country had come under control without a vaccine, then that could allow us to enter alert level 1. It would depend on a few more things than just the vaccine. Clearly, with the way that things are going right now elsewhere, despite our own favorable epidemiology, even the vaccine at this point, with only a small portion of the population going to be vaccinated by the end of the first quarter of 2021, we wouldn't really see us being able to lift any of the measures or many of the measures that we have in place at this point.
But Jody, they're still modeling this nationally, even to try to figure out the impact of the vaccine and the different epidemiology with respect to how you model that in terms of probabilities and the impact it has on populations. So these are questions that everybody is currently tackling and answering across the country.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. As we move through these phases for the vaccine rollout, how and when will people be notified that they are eligible to receive the vaccine? And I guess how much of a window will people receive? How much of a window of time will people receive before they're told that they can get it?
Dr. Haggie,
So I think at this point, we know that clear communication has to be part of that, and that will be, communicated to people both through this venue, through other venues, and then we'll have the regional health authorities working with us as well, and our Indigenous partners working with us to really help to get that message out there as to when people are able to get the vaccine, at what stage we're doing what priority groups. Again, this is a pretty fluid plan. It depends on a lot of things that we simply don't have the answers for right now with regard to other vaccines coming online and things like that. So it is something that will be updated on a regular basis.
And from what I understand, we're saying now that the COVID vaccine can't be administered with other vaccines, and that there should be a 2-week window in between getting the COVID vaccine and any other type. For those that may consider themselves to be under this initial phase of the vaccine rollout, and given that we're just starting that process now, if someone considers themselves to be under phase 1, should they hold off on getting other vaccines at this time so that if they get that call, they can be ready to receive the COVID vaccine?
So, Richard, just to be clear, are you speaking of different types of vaccines for different diseases, or different vaccines in terms of AstraZeneca versus Moderna versus Pfizer for COVID?
Different types of vaccines. So say the COVID vaccine versus
Measles, mumps, rubella, whatever. Yeah.
Yeah.
Yeah. So, certainly vaccination has to be a discussion that happens between a healthcare provider and a client. And I guess it would depend on the need for whatever vaccine it was. So where the urgency lay. So if the urgency lay with having another vaccine because there was a potential exposure, or because there's some other reason why you need to get that, then you have to make that decision based on a discussion with your healthcare provider. Really can't generalize in that situation.
Thank you.
Our next questions are from Elizabeth Witt with All Newfoundland and Labrador. Please go ahead.
Thank you. I'm curious, what is the estimated fiscal investment the government is making into rolling out the vaccine, so including purchasing these ultra-low temperature freezers?
That's a good question, Elizabeth. We have had 2 freezers guaranteed to us with federal money under the Public Health Agency of Canada. I can get you costs for our other equipment, but there are other low temperature freezers that will also be supplied through the Public Health Agency of Canada through federal funds. As to the cost of a vaccine rollout in terms of our personnel and our public health nurses, for example, again, I don't have that figure to hand, but I'm sure we can find it for you.
Thank you. And to follow up on that, back in late March, the government also established the COVID-19 contingency fund, and I'm curious, how much of that has been spent?
Well, the COVID contingency fund was meant for numerous different programs. We can certainly give you a breakdown of how it's been spent to date, but it's worth repeating what Dr. Haggie has said previous, that a lot of the expenses have been borne to date by the federal government, including some of the freezers, and of course we can't lose sight of the fact that the federal government is paying for the vaccines themselves, which come at a significant cost, obviously. But in terms of the exact breakdown of our costs in terms of personnel, and certainly we can provide that at a later date, but it's worth every penny.
Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hello. I'm wondering how the fact that we're vaccinating healthcare workers first will have an impact on capacity in hospitals and different healthcare institutions. Will it have an impact on capacity?
In the early stages, we're concentrating on those workers who would be particularly at risk from COVID. So, for example, public health nurses, vaccinators, COVID testers, those kind of individuals, then working into the inpatient setting. But essentially, for that rollout, the more staff within a regional health authority that get vaccinated, the less impact on staffing will happen as a result of a COVID surge. So it's, again, it changes with time. It will be a minimal impact at the beginning, and over the course of Q1 and into Q2, we'll see a significant potential benefit. But again, it's often hard to measure what doesn't happen.
And is the province's new registry for COVID vaccinations up and running?
Yes, we're using the template that we developed for the influenza vaccine. It's electronic, it's searchable, and it's key for this because certainly the first two vaccines that we know of do require a second dose. Usually with Pfizer, a fairly tight timeline of 21 days, and with Moderna, there's a little bit more flexibility, but it still requires identification for a second dose. The vaccine supply we have, we are going to use to vaccinate people, so we will keep that second vial, or that second dose rather, for an individual, say for example, who had their first shot today. Their second dose is guaranteed.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
Yes. Vaccine passports. Other provinces like Ontario have announced that they're going to use them. We don't know what privileges that might entail yet, but will Newfoundland and Labrador be issuing something to people as they get their vaccine that in the future might be used to, for example, skip quarantine or allow them into larger settings as we get more vaccinations?
Well, it's certainly something that we're still considering, but people do get proof of vaccinations. So, you know, just as our children get measles, mumps, rubella, there's proof of vaccines. There's proof of vaccinations given to individuals and patients as they get vaccinated. In terms of a distinct passport, that's still something that the vaccine team is considering.
Thank you.
Peter Jackson with the Telegram, do you have a final question?
I do. Is there a problem if a frontline healthcare worker decides they don't want the COVID-19 vaccine?
We've not got a policy of mandatory vaccination. We have never had that. I know other jurisdictions have toyed with that in the past. Particularly, I think British Columbia tried that with the flu vaccine for frontline healthcare workers, and I think it failed a court challenge. I think, obviously, in terms of risk to that individual, that would be an operational or a management decision to be made at the front lines in conjunction with discussions with staff as to whether or not everyone felt safe with that situation, as well as the individual concerned who would be perhaps a greater risk than they might need to be.
Thank you.
Jody Cook with NTV, do you have a final question?
Yes, thank you. With Christmas being just over a week away, many people very excited about that, but with 5 new cases today, I can't remember when the last time was that we had 5 new cases. It's a bit of a jump. They're all travel related. So there is, I guess, the question now about exemptions. And are you fielding a significant amount more at this time over the last 10 days, just outside of Christmas, and what those numbers have looked like? Could you answer that today, or is that something you might have to get back to us on?
So I can't speak to the actual number of exemptions. I guess we would have to get back to you on that. But, you know, it's not unusual that you'll see a small jump in cases. I think, you know, what we have to remember is that our numbers are small, so if you have more than one, it seems like a lot. But this is, like, none of these cases are concerning in the sense of onward transmission. People are isolating. People are following the rules. So these travel-related cases, this is the whole point, is to find them, be able to isolate them, and make sure they're being cared for properly. So, you know, there's no more concern because there's 5 today. As you know, we're not seeing that onward spread.
Thank you.
Richard Duggan with VOCM, do you have a final question?
Yes, so we saw our first 2 vaccinations today. How many more vaccinations are expected to administer over the next couple of weeks?
Well, we know we've got 2 trays. That equates to 975 individuals who will be vaccinated. So that's our target for this delivery. We expect a second delivery of a similar size next week. So that'll be another 975 people. And then after that, the schedule is a little less clear. And certainly the criteria around mobility would be up for discussion.
Thank you.
Elizabeth Whitten with All Newfoundland and Labrador, do you have a final question?
No, they were answered, all my backups.
Thanks, Elizabeth. Patrick Butler with Radio Canada, do you have a final question?
Yes. The 5th confirmed case today is a male under 20 years of age. Is this a school-age children? Is there a school-age child? Sorry. Is there a school involved? Are there other children in isolation? Given there's been a lot of issues related to rumors going around and schools, parents being worried, can you give us any information about that case?
That case is actually under investigation. I really don't know anything more about it than what I reported here today. It came in just before we were coming out, so I don't have that information.
Thank you, everyone. Premier, do you have any final comments today?
Thank you again for joining. Today is indeed a historic day, and I think it's worth everybody's peace of mind and time to pause for a moment and remember where they were today, December 16th, as the first vaccines for this pandemic were distributed and inoculated in patients in Newfoundland and Labrador. But to echo the comments of the panel here today, this is just the first in many steps required to get past the finish line in this pandemic. So please continue to follow public health guidelines. I know it's going to be tough. I can appreciate the anxieties, and I also equally can appreciate the desire to celebrate the Christmas season. But we need to follow the rules. That the rules have shown for Newfoundland and Labrador that it works. It's been working. It continues to work. If we continue to follow the rules that are set out by Dr. Fitzgerald and her team, we will get through this holiday season and out the other side, and we'll get more people inoculated and get to the finish line. So please continue to follow the rules, look after yourselves and each other, and we'll get through this together.
Thank you, Premier. Take care, everyone. Stay safe and enjoy the rest of your day.